welcome to the medwireNews podcast. Here we are speaking with Victoria Ruffing, Nurse Manager at the Johns Hopkins Arthritis Centre in Baltimore in the USA, on how to talk to patients about biosimilar drugs. The past few years have seen the approval of the first biosimilars for the treatment of rheumatic diseases. In early 2018, the American College of Rheumatology issued a white paper recommending the use of these agents when appropriate. Therefore, patients may be switched from originator to biosimilar drugs now and in the near future, and they are likely to have a number of questions for their healthcare providers. Such questions might include what biosimilars are, how they differ from their originator drugs, and what they can expect after the switch. Victoria, please could you describe a typical conversation between yourself and one of your patients on the topic of biosimilar drugs?
If we know that the patient's going to receive a biosimilar medicine, we will educate the patient on what that means and then answer any questions they might have. We have to explain what a biologic is first. So if a patient's already receiving a biologic and is switching, then hopefully they understood what the biologic was that they were on. But if it's brand new, regardless of whether it's a biosimilar or an original biologic, in our clinic, what we do is we explain a bit about the immune process, your immune system, and how biologics can target specific pieces of the immune system to stop the inflammatory process. So we go through that, and we go through what the potential side effects may be, what we're asking the patient to look out for, what we want the patients to do in case of infection. There's no difference between biosimilar and originator when we're explaining biologics to patients.
One question that patients may have is how biosimilars differ from generic medicines.
Well, it's not too hard to understand the difference. A generic medicine has the same, a copy exactly of the active ingredients that are in the, if you will, brand name product. For example, ibuprofen is ibuprofen, whether it's a store brand name or it's a brand name that we're used to seeing advertised on the television. But when we're talking about biosimilars and original biologics, we'll call those biologics because that's really what they are, both the biosimilar and the originator. They come from living cells. So a living cell cannot have an exact copy, but it can be highly similar. So what happens is the manufacturers have to prove that their highly similar cell line will do the exact same thing as the original product. So that's what they have to spend time in trials, clinical trials, to prove.
In Victoria's experience, patients' main concerns about biosimilars are related to their safety.
I think number one is that the idea of safety, patients want reassurance that the drugs they're taking are safe and they will not cause harm. Mostly the concerns do come around side effects and safety, such as infection and kinds of cancer. We spend a lot of time addressing those concerns and what patients should look for, what kind of symptoms they may experience that would lead them to the conclusion that they may have an infection. The other thing that we can demonstrate to patients and reassure patients that there's been no data showing that biosimilars are inferior to the originator product, nor are they superior to the originator product. So the side effects for a biosimilar are going to be the same as with the originator. So we just have to make sure that we are educating patients on what side effects they may experience and what action they may need to take as a result of certain side effects.
And Victoria explains that some people may be confused about whether the safety information they see refers to originator or biosimilar drugs.
When we get into safety, it's the same for reference products or original products as it is for biosimilars, but that's something that patients really want to feel more comfortable with, is the safety aspect. Because even though they're getting a biosimilar, what they may know about the biologic is what they know about the originator because of advertising on television or advertising they may have seen in a magazine. So if you see a drug advertised and you hear the kinds of warnings that are given, like this may cause infection, this may cause cancer, then patients are concerned about that, whether it is the biosimilar or the original that is putting out that information. I think the most reassuring thing is that we haven't seen a difference in safety. I think that, originally, oh my gosh, there was such a worry that there would be such a difference in biosimilars and originators as far as, are they going to be as effective? Are they going to be as safe? And the answer right now is yes, they are. So I think people can be reassured that this is not an inferior product that they would be receiving.
So, as Victoria mentioned, the evidence to date about the efficacy and safety profiles of biosimilar agents is reassuring, and she does not believe that people need to be concerned about biosimilars being inferior. One of the challenging things, however, is that people are not always informed when they are going to be receiving a biosimilar and when they are going to be prescribed the originator drug. Victoria explains the situation in the USA.
In the United States, rules vary from state to state if the patient will be informed that they're getting a biosimilar. The FDA has said that all biologicals are interchangeable, meaning originator adalimumab is going to be the same as biosimilar adalimumab. So they're interchangeable, but each state has laws on their books that will regulate if it can be substituted and whether patients need to be informed. So because we haven't seen any changes or any differences in the safety signals, we may not know, and we may not be addressing that with patients. We just don't know. I'm in the state of Maryland, and patients would have to be informed in the state of Maryland that they're being switched to a biosimilar. But as of yet, I haven't had any patients come to me and say, oh my gosh, I was informed that I was switching to a biosimilar. So it's a little hard to tell now, as of yet, what's going to happen and how it's going to happen. And I can guarantee it will happen different ways across the country. It's not going to be uniform as to how patients are informed about the switch to biosimilars.
Another question patients might have is whether they and their healthcare providers have a choice about whether to switch from an originator to a biosimilar drug.
I don't think that we will have a choice. I think if the insurance company says you need to switch to biosimilar drug, then we are not going to have any argument to say no, don't switch, because we can't say that the originator that they were on is superior or that the patient needs to stay on that. I think time will tell if there does seem to be anything that happens, after, if you've been on a drug for X number of years and then all of a sudden you're switched to a biosimilar, we don't have that data. So time will tell if there is going to be anything that comes about it. But as of now, I think we're going to have to follow what the insurance company is telling us we have to do.
Looking to the future, Victoria explains that it's not currently known how many people are going to be prescribed biosimilars and whether or not they will be cost-saving.
Now, it's unclear whether the insurance companies are going to push biosimilars. The thought out there is that while generic drugs, they can cut the cost of a brand name drug by 60 to 80%. A biosimilar may only cut the cost by 20% to maybe 30% at the most, because these drugs made from living cells are incredibly expensive to make. So you're not going to see a huge price change by switching to a biosimilar. So it's hard to say, because of course we know that some insurance companies work with the manufacturers of the originators to get the drug at a lower cost anyway. So it may all come out even in the wash. It's just tough to say right now what's going to happen. We'll just need to collect data as time goes by to see what happens.
So while clinicians wait to see the full impact of biosimilars on the field of rheumatology and how cost-saving they will be, for patients it seems to be about giving them the right information about biologics, be it originator or biosimilar, and addressing concerns about safety. Thank you very much to Victoria for sharing her thoughts on how to talk to patients about biosimilars. You can find out more about the data supporting the equivalence of biosimilars and their reference products in our hot topic review entitled Biosimilars: Story So Far.